So thank you for the question. If I want to answer this question, it would take maybe hours, because this is a long journey. Start almost 7 years ago. And the idea was to confirm that the hemodiafiltration, but with right dosing. As you know, the convective volume is a marker of efficiency. And the idea was to develop a study showing that there is a superiority from high volume hemodiafiltration versus high flux hemodialysis. So that's part of the game. And based on this consortium that we created with a European Union funding, because this is Horizon 2020, we get the approval for developing the study, a large study showing the beneficial effect or exploring the beneficial effect of high volume hemodiafiltration versus hemodialysis, not only on the hard clinical endpoint, mortality, but on the patient perception. And the PRAMS, the idea was to assess both mortality and patient perception. And by the way, the study was developed, so unfortunately, when we start including the patient, the COVID came and create a lot of difficulty in recruiting the patient. But still, at the end, we collected almost 1,400 patients, split in hemodialysis, high flux, in a high volume hemodiafiltration. And at the end, we can make the analysis over the 3 years, showing the beneficial effect on mortality by reducing by 23% all-cause mortality, which is already a fantastic result, since today we did not get any international study showing any superiority of the hemodiafiltration. This is the first time we get a positive result on international study in hemodiafiltration. But again, it's a long journey. It's not only just reflecting the science. We need to understand that there are some best practices about hemodiafiltration. So at the end, it's not a generic term, doing hemodiafiltration versus hemodialysis. We need the physician or the caregivers need to understand that it's a complex system where you have to make sure the best practices are applied to the patient. And the best practices, for example, the blood flow, dialysis surface area, treatment time, a lot of factors, anticoagulation. So we know that it's not only just a point of hemodiafiltration, but reaching the target show clearly that if you reach over 23 liters, and the study shows that over the 3 years, the average was 26 liters, 25, 26. So that means it's easy. Now, I did not talk about the machine who are maybe supposed to facilitate the convection volume, but still, in average, 97% achieve the target. So, practicality is already done. Superiority of the technique is given by the result of the study from the CONVINCE. We are looking now for the patient-reported outcome. That will come soon, but there are some quite encouraging results. I don't want to reveal anything, so we are on this way. And certainly we will develop some new analysis or sub-analysis to understand what are the beneficial effects inside this population. Why the cardiovascular, why the beneficial effect on the prevention of the infection. So we have a strategic plan to make further analysis. But already, as in my mind, to make a plagiarism of Armstrong coming on the moon, it's a small step for the science, but a big leap for the patient on dialysis. That's already a good point.